Okay, activity 12 is the urinary and the reproductive systems. This is the last of the new information that you will get before the final. So you did it, you're done. Um, the final is literally the questions that are pulled from the quizzes that you've been taking. So my recommendation for studying for the final is to go over those quizzes repeatedly, because you will get different questions each time you take the quiz. So instead of doing a practice final, it would make more sense for you to go ahead and do those quizzes. And it will only take your highest score, so it can't hurt you to take those quizzes. And I won't put out a video next week, but if anybody has any ideas for a video that they would like me to do to help you study, I'm always willing to do that, so just let me know. But for the urinary system, table 12-1, basically we have two kidneys, a right and a left kidney. The right kidney sits a little bit lower than the left because of the liver in the upper right quadrant. There are ureters that are attached to each kidney, and they empty into the back of this structure right here, which is the urinary bladder. And then we have a urethra, which is the connection from the bladder to the external world. Here is a coronal cross-section of the right kidney. So the outer casing of the kidney here is called the fibrous capsule. It helps the kidney to maintain its shape and is also a protective layer. There's also a lot of adipose tissue that surrounds the kidney for protection and insulation as well. So just under the fibrous capsule, there is a region of the kidney that is called the renal cortex, and it makes up this entire outer edge of the inner part of the kidney. And then the middle part of the kidney includes all of these pyramid-like structures and the columns in between. That is called the renal medulla. And on an actual kidney, it looks a little bit darker. The renal medulla shows up a little darker than the outer cortex. So in the medulla, there are parts of the cortex that dives down here and forms these columns between these pyramids here. So these are the renal pyramids, and then the renal columns. Those are both part of the renal medulla. And the human kidney has between 8 and 15 of these renal pyramids. And the pyramids will come to an apex here, and where they come to an apex, it is called the renal papilla. So then the renal papilla are going to open up into this first collecting region, which is called the minor calyx, and plural would be calyces. So each of the pyramids gives way to the renal papilla, which then empties into a minor calyx. So each of these pyramids has a calyx. Where you have two or more minor calyces emptying together, we have a major calyx. So this here is a major calyx, and we have one over here as well. So the major calyx, and in some cases the minor calyx, will merge together to form this big funnel feature here, and that's what it is. It's actually collecting urine into what's called the renal pelvis. So this is the renal pelvis here. And then the renal pelvis is going to empty into a ureter. And those ureters are going to travel through the abdominal pelvic cavity and then enter into the bladder. So a renal lobe is a region of the kidney where if you take a section of the cortex, part of a column, and then the pyramid in the middle, and part of a column on the other side, that is the lobe. So depending on how many pyramids there are in the kidney, that determines how many lobes there are. So this slide is looking at blood flow through the kidney. So we already talked about the renal pelvis. It looks like these blood vessels are going through the inside of the renal pelvis, but they're not. The nephron system and the drainage system into the ureter is a very different system than the circulatory system. So you're just not seeing the top half of this renal pelvis. It's definitely separate from the renal blood vessels. So we have the renal artery coming in. If you remember, it's a branch off of the descending abdominal aorta. And right here near where the pelvis is, it will bifurcate into the segmental arteries here. So then these segmental arteries are going to split up and run in that column there. And where they run between the columns is called the interlobar artery. And then at the base of the pyramids, the long end of the pyramids, the artery will wrap around and anastomose with the other side and become the arcuate artery. And then we will send smaller branches off into the cortex, and those smaller branches are the interlobular arteries. So make sure you understand the distinction between interlobar and interlobular. Those are two different arteries. Interlobar are in the renal columns, and the interlobular are up in the cortex. So there's tiny branches coming off of the interlobular arteries, and the branches coming off are called afferent arterioles. And this is happening. There's millions of these units in the kidneys. So this is happening all over the place, not just this one. So the afferent arteriole comes out, it enters into this collecting capsule here, and it coils in on itself and it becomes this specialized capillary here. It's a fenestrated capillary bed right here. And that little coiled in capillary is called the glomerulus. The glomerulus literally means a small ball of yarn. So we have the glomerulus here, and then blood will exit the same tube, and instead of emptying into a venule as we normally would in a capillary, we enter into another arteriole, the efferent arteriole. And again, this is all the same tube, just one end of it is entering into this capsule here, coiling in on itself, and then exiting as the efferent arteriole. And then the efferent arteriole is either going to turn into a capillary bed surrounding these convoluted tubes here. So you see these beige colored convoluted tubes. That's part of the nephron that we're going to go over. But what we're looking at here is the capillary bed that's surrounding that tube, that convoluted tube. And where the capillaries are surrounding the tubes, they're called the peritubular capillaries. Or that efferent arteriole could send a capillary bed around this loop here. And the capillary bed surrounding the loop is called the vasa recta. So the efferent arteriole could either be the peritubular capillaries or the vasa recta. And then that vasa recta will then turn into a venule, which then will empty into the interlobular vein that is in the cortex here, and then will empty into the arcuate vein, and then the interlobar vein. And the main difference here is we do not have segmental veins. So these interlobar veins will continue on and empty into the main renal vein here. So that's the main difference between the veins and the arteries here. There are no segmental veins. Okay, so then let's look at table 12-4. We're looking at the nephron, and you'll hear this. Everyone calls it the functional unit of the kidney. So the nephron is where the blood is being pushed through the glomerulus, and certain molecules are being allowed to pass through the fenestrated capillary bed here of the glomerulus. And there are a lot of other features of the glomerulus that are regulating which molecules pass through, but for the most part, anything small enough to fit through the fenestrations gets pushed into this space right here. And the capsule surrounding the glomerulus is called the glomerular capsule or the Bowman's capsule. So the combination of the glomerulus and the glomerular capsule is called the renal corpuscle. So the filtrate coming through, well, actually it's at that point it's blood plasma. The plasma is being pushed through the glomerulus and collecting in this capsule here. And this capsule has a space, which is called the capsular space. And the inside of this capsule has a lining, and that lining is the parietal layer of the glomerular capsule. And then that lining wraps in on itself and then adheres to the glomerulus itself. And at that point, it's called the visceral layer of the glomerular capsule. And it's basically composed of those podocytes that are the little cells that are going to help also regulate what molecules are able to pass through the glomerulus. And that's we could spend an hour just on how that whole system works there. But just for the sake of our lab, we're going to skip all that. And definitely, if you have any questions from your lecture or anything about the way that this system works, please ask me, and I am more than happy to answer those questions. I just don't want to overwhelm with too much information for lab. So the blood plasma is being pushed through here and collecting in the glomerular capsule, and then it will start to dump into this first tube here. And this first tube is called the proximal convoluted tubule, and it's considered proximal because it's the closest to the renal corpuscle. So at this point, the blood plasma is being modified, and certain things are being reabsorbed back into the bloodstream. That things that made it through the all of the regulatory mechanisms here, stuff that made it through there, but we kind of need back in our bloodstream, like water and nutrients and vitamins and glucose. And depending on what our body needs, that is going to be fine-tuned into these tubes here. And so at that point, it's called filtrate. So the blood plasma will then be called filtrate, and the peritubular capillaries sit in close approximation to those convoluted tubules, and they are going to reabsorb either through diffusion or active transport to get the things that we need back in our blood supply into the capillaries. So this proximal convoluted tubule will eventually dip down here into the medulla, and this entire loop here is called the nephron loop. So we have a descending limb of the nephron loop and an ascending limb, and those again are surrounded by the vasa recta, and there is definitely a lot going on here too that we won't go over, and different things are being reabsorbed at different levels of the entire nephron. So the inside layer of the nephron will change to all those different types of the cells we looked at, the endothelial cells. And then we eventually end up in what is called the distal convoluted tubule. And the distal convoluted tubule will come really close to the afferent arteriole. It doesn't really show it in this picture, but it shows it in this picture up here, but it comes in really close contact with that afferent arteriole because there is a communication that happens here between the distal convoluted tubule and the afferent arteriole, where we have a system called the juxtaglomerular apparatus that is going to regulate our blood pressure right here. So it's going to send signals to make this distal convoluted tubule more permeable to water and sodium chloride, which then will increase our blood volume and then thus increasing our blood pressure. Then the distal convoluted tubules are going to empty into this main collecting tubule, and well, these little collecting tubules are dumping into the collecting duct. And like I said, there's millions of these nephrons in the kidney, so there's a bunch of collecting ducts. And those collecting ducts are going to, you see in this picture right here, they run down the length of the pyramids, and they will eventually dump into a minor calyx. And then the collecting duct here will, like I said, empty into the minor calyces, and then it will, at this point, it is considered urine. So it's not considered filtrate anymore because there is actually some fine-tuning of the urine still happening in the collecting duct. But once it hits the minor and the major calyces, that's it. That's what you get. So at that point, we're urine. So the urine flows into this renal pelvis and then will flow out and then down through the ureter. Here you can see the ureters emptying into the bladder. So this picture is a little bit deceiving. It looks almost as though the ureters are entering at these top corners of the bladder. What it's not showing you is they continue on in the back and they actually burrow through and tunnel into the bladder, and these are the ureter openings right here. And so that tunneling in through the muscle of the bladder helps keep urine from flowing backwards up into the ureter. So if somebody has urinary reflux, that's the problem, that the bladder fills up with urine, and then these aren't effectively closed off with either the pattern of the way that the ureter is entering the muscle or other problems. It's not closing off enough, and the urine is back flowing up into the ureter. So the bladder has a very specialized muscle here. You can see it in the muscle wall picture here. So this muscle wall, it's got 3 different layers in it, but it is called the detrusor muscle, and it is a smooth muscle. So it's controlled by the autonomic nervous system. And you can see here we've got the transitional epithelium here. And you'll see in the inside layer of the bladder, you can see that there's like these rugae in here. I don't see it on your white sheets, but these rugae allow for the expansion along with the transitional epithelium to allow the bladder to fill. You can see on this picture here how the bladder can fill with urine. And there is a little portion on the back side of the bladder. There's a triangular area that's formed between the openings of the ureters, where the ureters empty in, and the funnel where the urine is going to pass into the urethra. So this little triangular area here is called the urinary trigon, or the urinary trigone, whichever way you want to pronounce it. It's actually a combination of tissues extending out from the ureters, and it does not have rugae in it, so it's smooth. And the function of the trigone is to make sure that, once again, that urine doesn't backflow up into the ureters, but it does not have as much smooth muscle as the detrusor muscle, and so it does not contract down as hard when the bladder's emptying. So it allows for this funnel shape to maintain and allow for complete emptying of the bladder. Then the urine empties from the bladder into the urethra, and we have 2 sphincters. We have an internal urethral sphincter here that is has involuntary smooth muscle in there. So when your bladder gets full to the point that the stretch receptors are activated, and the bladder will then open this internal urethral sphincter. And then the urethra passes through what's called the urogenital diaphragm, and I'll talk about the urogenital diaphragm a little bit more when I do reproductive as well. But the urethra passes through the urogenital diaphragm. Basically what the urogenital diaphragm is it's like an inverted diaphragm that we had up near our stomach and our liver, that diaphragm. If you turned that upside down and nestled it into your pelvis, it's like a bowl that's holding all of your pelvic organs in place. And it has holes in it, just like the diaphragm had holes that had spaces for the aorta and the inferior vena cava and the esophagus. The urogenital diaphragm has openings in men for the urethra and the rectum, and in women it has openings for the urethra, the rectum, and the vagina. And urogenital diaphragm is not it's not a skeletal muscle in most areas. There are areas of skeletal muscle near the sphincters. So the skeletal muscle surrounding the urethra, where the urethra passes through the urogenital diaphragm, is called the external urethral sphincter. And that one we do have control over. Women who've had multiple pregnancies or very large babies, it stretches out the urogenital diaphragm, and the urogenital diaphragm doesn't always come back to its original shape. And so you have some weakening of that wall and a weakening of this external urethral sphincter, which can then lead to urinary incontinence. We can't stop that urine stream on command, and so urinary incontinence is when urine is released when there's a sneeze or jumping or movement or coughing. It's not the most pleasant of conditions, but it's definitely repairable. And there are exercises called Kegels, which you practice pinching off your urine midstream, and it strengthens these skeletal muscles in here. So sometimes you'll hear commercials about overactive bladder, and you're thinking, what is an overactive bladder? I feel like I've got pretty good control over my urination, but what overactive bladder is this detrusor muscle tends to spasm and causes the patient to have feel like they have to go to the bathroom frequently. And so if you've heard of oxybutynin or ditropan, that medication targets the detrusor muscle to relax. And then there's also a medication that it's actually an antidepressant, but they found it useful for bedtime wetting for older children. So the medication triggers the trigone to contract, which then eliminates the bedtime wetting. So in that medication, I don't know if you've heard of that one, it's imipramine or tofranil. So interesting that we can target these specific areas of muscle in the bladder. Okay, so let's look at some of the models that you might see on your quiz. So the right and the left kidney, these are the ureters. And here is the urinary bladder with the detrusor muscle on the inside. You can see the rugae, you can see the urinary trigone back here, and you can see the urethra. And this structure right here is a gland that's found in males. It's called the prostate gland. And this thing on top of the kidneys, these are your adrenal glands, and we don't go over those in lab, but you might go over those in lecture. But you can see some parts of the gross anatomy of the kidney. It's not the greatest. There's better models for that, but you can see the outer cortex, obviously the fibrous capsule, easily seen on this side, the different pyramids, the columns. You can see some of the blood vessels, the minor calyx. Here's a minor calyx. Here's a major calyx right here because we've got two. And then the renal pelvis right here. And then obviously the renal artery and the renal vein. In this model, you're probably wondering what these little things are right here. Right here and right here. Since this is a male urinary system, these back here are actually called the ductus deferens, and they're part of the reproductive system. So don't let these little tubes confuse you. These are not the ureters. They're not part of the ureters. It's just the view that you're looking at on this model makes it look like they're actually part of the ureters. They're not. They're actually coming from the back side of the bladder and coming around to the front. So here's our coronal cross-section of the kidney, and I stole this picture off of a quiz. So what would be the answer to this one? What is that pointing to? It's pointing to the outer fibrous capsule of the kidney here. You can see the cortex, the column, a pyramid. All of this, if this was selected as your question, would be considered a lobe because it includes the cortex, the pyramids, and then part of the cortical material in the columns. And we have our minor calyx here. We've got a major, so this would be number 12 would be a minor calyx. Number 13 would be a major calyx. You can see the renal papilla, the renal pelvis. So 14 here would be the renal pelvis. And then the ureter is going that direction. This right here is just fat, normal fat that's found in the kidney. And obviously the artery and the vein. You can see the segmental arteries, and then the interlobar, the arcuate, the interlobular. You can see these little white dots here. Those little white dots are glomerular capsules. You can see parts of the nephron here. Here's a nephron loop, the convoluted tubules, a collecting duct, and what else can we see on this model? So these veins coming back in, those are interlobar veins. Remember, because we don't have segmental veins like we do the arteries. So these are the interlobar veins. And here is our model showing the kidney. This is showing the nephron, and then the glomerulus in the glomerular capsule. So if you look really close on this middle model here, you can see, let me try to zoom in. Maybe not. There we go. So you can see the glomerular capsule here. This would be the proximal convoluted tubule. The nephron loop, or the loop of Henle. This is the descending loop here, and the ascending loop here. This is the distal convoluted tubule emptying into the collecting duct here. And so these are complete capsules, the ones that are total, you can see the white on the outside, and these ones you can see a cross section of the capsule so that you can see the glomerulus on the inside. So this vessel right here is the arcuate artery, and then this one is the arcuate vein. And here's an interlobular vein here and an interlobular artery here. And then this artery and vein would be the interlobar artery and vein. So let's look at a close-up of the glomerular model. Okay, so here is the glomerular capsule here. So if it was pointing to the inside here, like this lining here, that would be the parietal layer of the glomerular capsule. And if it was lining the glomerulus, you can see here there's actually podocytes, and that is the visceral layer of the glomerular capsule. So again, the visceral layer includes these podocytes here. So the podocytes you can't see on this side, but this entire structure, you would, if this whole thing were circled, it'd probably be asking for the glomerulus. So this is the afferent arteriole, and this is the efferent arteriole. So how can you tell the difference between the two? On the other picture in the book, it didn't show you this swelling of cells on the afferent arteriole, and these are part of the juxtaglomerular apparatus. These are the juxtaglomerular cells. So there is the afferent arteriole is a little bit wider and thicker than the efferent arteriole. And then this right here, this is actually the distal convoluted tubule. And they're showing you the simple cuboidal cells that are in the distal convoluted tubule. So there's macula densa cells, and these communicate together, which are the long cascade of events, but that's the juxtaglomerular apparatus. So this here is the beginning of the proximal convoluted tubule. Okay, so welcome to reproductive. I'm on page 218 of your white sheets, and table 12-6. So we're going to look at the external female genitalia, aka the vulva. So the vulva includes the labia majora, minora, the opening to the vagina, the opening to the urethra, the clitoris. Does not include the anus. If we were to look at this entire diamond shape here, that would be considered the perineum, and the perineum does include the anus and the skin between the vulva and the anus. And the mons pubis is this fatty pad that sits on top of the pubic symphysis here. And post-pubescence, it is covered with hair, and then that hair also grows on the labia majora on the outside here. The inner fold is the labia minora, and then we have the clitoris here. So the clitoris is homologous to the penis. It is full of erectile tissue. The only difference is obviously the size, and that the urethra does not pass through the clitoris as the urethra passes through the penis in the male. But if we were to remove the skin here, which the skin, by the way, covering, it's like a little hood to the glands of the clitoris, and the glands is just the very exposed tip of it. That little hood of skin is called the prepuce, and males have a prepuce as well. The prepuce is what is removed in males during circumcision. So if we remove that skin and surrounding tissue, we can see the erectile body of the clitoris. So the corpora cavernosa, there are these two channels in the body of the clitoris that become engorged with blood when the clitoris is stimulated, and so the penis has the similar corpora cavernosum that cause an erection. And again, this is all internal on the female with the exception of the glands. And then we have this erectile tissue in blue here that is called the crus, and it attaches to the pelvic bone here. So men also have a crus of their penis attached to the pelvic bone. And then these other structures here are not on your white sheets here, but they are a part of the model that we do have of the clitoris. This purple one here is tucked underneath the labia minora, and it is called the bulb of the vestibule. And then we have this one here, the orange one underneath, which is the greater vestibular gland. And this is the one that produces a mucus-like substance. And you can see the openings to this gland right here and right here. that provide lubrication in this area. So again, those aren't on your white sheets. The only part that's on your white sheets is the crus, the body, which includes the two corpora cavernosum, and then the glans, which is the exposed part. And did I say the prepuce? I don't know. Did I say prepuce? Anyway, the prepuce. And then we have the vestibule. And the vestibule is basically just the entrance into the vaginal canal and the urethral orifice. So we have the external urethral orifice and then the vaginal orifice. So again, the vestibule, just like we've learned a couple of other vestibules, it's just an opening or an entrance. So here is the internal structures. We've got two ovaries that store the immature eggs where they mature and then are released in ovulation. And we have the uterine or the fallopian tubes or the oviducts. And they are these tubes right here that attach and empty into the uterus. The uterine tubes have different segments to them. This part right here where it opens up is called the infundibulum. And the infundibulum have these little finger-like projections coming out that are called the fimbriae. So an egg is released from an ovary once a month, and it switches sides every month. So 1 month the right side will ovulate, and then the next the left side will ovulate. Usually only one egg is released. If more than one egg is released and both are fertilized, you end up with non-identical twins. If the egg splits into two, then you end up with identical twins. So the egg, let's say that, so the egg is released into the peritoneal cavity. It's not released directly up into the uterine tube. These fimbriae will gather in the egg from the peritoneal cavity, and that's why sometimes ovulation could be painful, and women can actually feel when they ovulate, because as that egg is released, there's fluid that is released with the egg, and that irritates the peritoneal cavity, and which is why ovarian cysts are so painful, because there's so much fluid that is released with that egg, with an ovarian cyst. So these fimbriae, they gather up the egg, they pull it into the infundibulum here, and then sperm, if they've been able to enter into the vagina, they pass up through the uterus and into the tube here. The sperm usually meet up with the egg right around this area right here, which is called the ampulla. So then the ampulla leads to the isthmus, and this would be considered the isthmus here. And then the uterine part of the tube is where the tube actually dumps into the uterus. So the uterine tube or the fallopian tube is the tube that has a lumen, and the egg passes through the lumen, whether it's fertilized or not, and then it will empty into the cavity of the uterus. So the uterus has a fundus. This upper dome part is the fundus. And in a woman who is not pregnant, the fundus will remain tucked into the pelvic cavity. And if a woman is pregnant, depending on the size of the baby and how many she's had, the fundus will start encroaching on the abdominal cavity. And as soon as it grows above the pelvic bones, that's when a woman would say she starts to show. So the uterus is starting to push the abdominal contents out and forward, and you can start seeing a little pooch. And so then that uterus, the fundus, will actually reach all the way up until it's encroaching on every other organ of the abdominal cavity. And the fundus is important clinically. It's used as a measurement as a pregnancy progresses. An obstetrician or midwife or nurse practitioner will measure from the top of the fundus down to the pubic crest, and they'll measure it in centimeters, and it usually correlates with how many weeks along the pregnancy is. So as soon as that fundus pokes out above the pelvic inlet, it can be measured. So at 40 weeks pregnant, the measurement from the fundus to the pubic crest should be around 40 centimeters. And the fundus is also what is massaged postpartum in order to get the uterus to contract down on itself after having a baby, because the placenta leaves an open wound on the inside of the uterus, and the uterus will contract down on itself once the baby is out and the placenta is out, in order to cut off the huge blood supply going to where the placenta was attached. So a massage of the fundus is done postpartum if the uterus isn't contracting down enough. And if the uterus isn't contracting down, that can cause hemorrhaging. So a CNA or a postpartum nurse or doctor will do a fundal massage where they massage the uterus to help push out any remnants of the placenta or any things left behind by the baby, to expel those parts of the uterus so that the uterus can effectively contract on itself. And if anybody's ever experienced those contractions after labor, they can be just as intense and painful as labor itself. So the body of the uterus is this portion right here, the main part of the uterus. And the isthmus is where the uterus will start to narrow and eventually get to the cervix. So I'm going to switch to a better picture for the rest of it. Okay, so in this picture, you can actually see the color-coded parts of the uterine tube, the infundibulum with the fimbriae, the ampulla, the isthmus, and the uterine part here. So if you were tested on those, it'd probably be off this picture. And you can see the fundus, the body, the isthmus of the uterus, and then we have the cervix right here. And this is all considered part of the cervix. I don't know if you need to know this, but there's the internal cervical os and the external cervical os. So I don't think you need to know that. So I'm not going to worry about it. But like I said, this entire region here is considered the cervix, not just this part that you would see with like a speculum exam. This cervix is actually important in reproduction. It has the external cervical os is like a donut-shaped opening into the cervix and then into the uterus. And at different parts of the menstrual cycle, the cervical will do some different things. So as a woman ovulates, the cervix actually dilates, and so this opening, it becomes greater, and it produces more fluid so that it allows for sperm to travel through the cervix easier. Humans, their number one goal in their reproductive system is to procreate. So our bodies do everything possible in order to be able to continue the species. So there are different layers of the wall of the uterus. The big muscular wall is called the myometrium, and the inner layer of the uterus is called the endometrium. And the endometrium is what is its job is to create a luxurious environment for a fertilized ovum. So the if it's a fertilized egg, it'll come in and it will bury itself, hopefully, into this upper part of the uterus, into the endometrium. And that's where the placenta will begin to develop, and then the fetus will begin to develop. The endometrium, by the way, in endometriosis is when this endometrium outgrows its bounds and it starts growing around some of the other structures outside of the uterus. So it almost formed like a scar tissue around all of this, which is not conducive to getting pregnant, and it causes a lot of pain during menstruation. And then we have the vagina. So this is the vagina here. And I think that's it for the uterus. So let's look at the ligaments and associated structures. So the first ligament is the round ligament of the uterus. And this picture right here, this is the round ligament right here. The round ligament, and it is not shown in this side, but this round ligament attaches the uterus to the anterior part of the abdominal wall. The round ligament actually passes through the inguinal canal and is embedded inside the labia majora. So as a uterus grows with pregnancy, it pulls on this round ligament here and causes pain. So sometimes when a woman is pregnant and her fetus is growing and the uterus is growing, she'll have a really severe side stitch or cramp. And sometimes it's mistaken even for appendicitis. But it is pain of this round ligament being pulled and the labia majora are being pulled. So it's not a very comfortable situation. Then we have the broad ligament. So just like we had the mesenteries surrounding our abdominal organs, we have a mesentery-ish type membrane that surrounds the uterus, and it almost looks like bat wings around the uterus here. And you can see that there are embedded structures. There are the uterine artery and vein that are embedded in there. The ovary is embedded in there. There's the ovarian artery and vein are embedded in there, as well as this yellow thing right here is a ureter. There's a ureter embedded in there. And this ligament you don't need to know. It's not on your white sheets. So this big fan-shaped membrane here is called the broad ligament. And on our models, it's kind of interesting. It literally looks like wings coming off of the uterus. So you can see here the uterine artery and vein. And again, the uterine artery, we didn't learn this when you did your blood vessels, but it does come off of the internal iliac artery. And then the uterine vein will dump into the internal iliac vein. And then we have the ovarian ligament. So the ovarian ligament is this gray one right here, and it attaches the ovary to the uterus. It is not a tunnel. It does not have a lumen. It is merely to attach the ovary to the uterus. So don't confuse the uterine tube with the ovarian ligament. They look very similar to each other. And then we have this suspensory ligament of the ovary, and it's basically where the ovarian vessels are coming in and out of this broad ligament here and attaching to and bringing blood to the ovary here. And we learned about the ovarian artery and vein. They're basically the gonadal artery and vein, which are coming off of the abdominal aorta and emptying into either the inferior vena cava or the renal vein, if you remember that. Hopefully you do. Okay, so here is a mid-sagittal section of the female pelvis. So to orient you, this is anterior, this is posterior. Here is the mons pubis, right here, just that fatty pad there. The hair growing on it, and then also the hair growing on the labia majora. And here's the labia minora. This is the clitoris here. And this, you can see right in here, is the urogenital diaphragm. So the urogenital diaphragm will kind of follow this pattern right here. It's you can see where it's got skeletal muscle in it, and it's basically just a fibrous sheet, which is why it doesn't always return to its natural shape. It's not a muscle that you can strengthen. You can only strengthen the skeletal muscle areas of the urogenital diaphragm. So this is the urethra. So in order from front to back, the openings here, we have the urethra, the vaginal canal is in the middle, and then we have the rectum at the back. And this is very important when you're learning to place urinary catheters. You always shoot for the top. So if it's a woman, if you're placing a catheter on a patient, they usually, if it's a woman, they will be on their backs, and so the urethra will be the most superior orifice to shoot for. So here is the urinary bladder. Whoa. And here is the uterus. And you notice that the uterus usually tilts forward, tilts more anterior. There are some anatomical variations where the uterus tips backwards. This just makes for complications with pregnancy sometimes. When placing an IUD, it creates complications. So the natural position of the uterus is the leaning, tilting forwards. And this is another reason why, the main reason why women during pregnancy feel like they have to pee all the time. They feel like they have a bowling ball sitting on their bladder, because they literally do. Because as the fetus grows, the uterus is going to come up this direction, and it literally compresses the bladder. Here is the cervix. We have the endometrium, the myometrium. We've got one of the uterine tubes. We have one of the ovaries. These are, this is a segment of the digestive tract. This is the rectum and the anus. And what else can we see on this picture? This is a ureter that is embedded. The kidneys and ureters are considered to be retroperitoneal. So they're buried underneath this peritoneum in the back. So you can see how this segment of the intestine is also considered retroperitoneal, and this part of the rectum. So this picture is a nice way to visualize what that means by retroperitoneal. Okay, I think that's it for this picture. So here's the same thing in model form. It's a little bit more involved. The same things we can see here. This is the urinary bladder. This is an opening for one of the ureters here. You can see how it comes in the back side of the bladder. And what we can't see is the urethra, but we can see the erectile tissue that sits underneath the labia minora and then the hairless labia majora. And the mons pubis would be right here. This is the vaginal canal and what is that? Oh, that is part of the uterine tube coming into the uterus. So this is a very tilted uterus. This is almost anterior flexed uterus, not just tilted, which is also a normal variation to have the uterus flexed over this far. And then we can see the other uterine tube and this fimbriae here, and then part of the ovary on this side. This thing right here is the round ligament. So you can see where it's going to pass through the inguinal canal alongside the external iliac artery and vein. So here's branches from the internal iliac artery and vein. And this is a ureter right here. And this is our little clitoris. And this structure right here, is the urogenital diaphragm. So you can see how the rectum passes through it, the vagina passes through it, and then the urethra would pass through it. Okay? So this is another model of the uterus. It's kind of a confusing view. This one is easier to visualize if you're actually able to pick it up and take it apart and move it around. But what we're seeing here is this is anterior and this is posterior. So this is the urinary bladder right here. Here's the uterus. And this is not the vagina. This is the rectum. So in order to see the vagina and the urethra and the anus, you'd have to pull this model apart and look at its cross-section. But the things that you can see from this view, you can see the fundus of the uterus. You can see the round ligaments that are coming anterior. You can see the uterine tubes and the ovarian ligament and the ovary here. And then this fan-shaped structure that I said kind of looks like the bat wings. That is the broad ligament. And you can see where the blood vessels are coming in, the ovarian blood vessels right about here. So here's another more clear view of this model. Again, the uterine fundus. You can actually see the body here as well. This is the uterine tube. The different parts of it are actually labeled here. So we have the fimbriae that are attached to the infundibulum. Then we have the ampulla, which then leads into the isthmus. And what you can't see is the uterine part right here. So here's our round ligament. The bladder would be buried under here. This is showing the pubic bones. So this model, there's like two pieces to this model. There's lots of pieces. There's this piece that sits inside the pubic bones that you can pull all this out. So the broad ligament all through here, the ovarian ligament, the ovary. You can see the ovarian blood vessels right here. So that's where the suspensory ligament of the ovary would be. And again, that's the colon or the rectum. So this picture I Googled it and pulled it off the internet. So this one you won't see on any of your quizzes, but I did notice one similar to the last picture we looked at. Okay, so table 12-7, this is looking at the mammary glands. So this is the breast tissue that produces milk. So this is a sagittal section of a breast. These muscles back here are the pectoralis major and minor. We have fat, which is what most breast tissue is made of. And then we have the milk producing glands in here. And a lobule is basically a collection of these glands that produces milk. And they, the breast tissue, the milk producing tissue is separated into lobes. And I didn't see that on your white sheets. But the little structures, the little glandular tissue that produce milk are the actual lobules that have milk producing alveoli in them. Not the same as the ones that are in your lungs, but similar structure. And then the milk travels through these ducts, and then the milk ducts will empty into the nipple here. So the part that sticks out is the actual nipple, and then the dark circle surrounding the nipple is called the areola. And there are suspensory ligaments that are connecting just to the underside of the skin to the lobes of the glandular tissue. And these suspensory ligaments, their job is to attempt to keep breast tissue upright. Obviously, as we age, or women who have larger breasts, these suspensory ligaments, their job gets a little tougher and tougher, and things aren't quite as upright as they used to be. Okay, here is our poor little very diseased model of a breast. You can see all these different sad things going on with this breast here. Lots of different malignancies and pathologic problems here. But what we can see here, we can see the different lobes and the lobules. We can see the areola out here on the outside, and then the actual nipple here, and then the suspensory ligaments here, and then the pectoralis muscles underneath. And these are ribs here, and then the intercostal muscles between the ribs. We're near the end. Table 12-8, the male reproductive. Just FYI, this is anatomical position for the male reproductive, with the penis pointing straight up in the air. This is important to know because we will be asking you which is the dorsal side of the penis and which is the ventral side of the penis. So in this view right here, this is the ventral side of the penis, or the soft underbelly side. Okay, the urethra is going to pass through this ventral side of the penis. So we have testes. So the white thing right here, this is a testes. We have a scrotum, and the scrotum is this skin that the testes, or the testicles, will be housed in. And the sperm are produced in the testes, or the testicles, and the sperm are very particular in their temperature. And the inside of the pelvic cavity is too warm for the sperm to produce or to develop properly. So the testicles are held on the outside of the abdominal pelvic cavity, and they're housed, like I said, in this scrotal sac here. The epididymis, this little thing right here, and I'll show you another view of it, is where the sperm are stored and where they mature. The other thing you can see on this picture, This is the glands of the penis here. And this is a picture of an erect penis. And so the penis does have a skin covering on it that is called the prepuce. And during an erection, the prepuce pulls back and exposes the glands here. And so the prepuce is what is removed during a circumcision. So let's move to a different picture. So here is our mid-sagittal section of the male. Here we have, this is the urinary bladder. And we already looked at this gland in the model. This was the prostate gland. You can see how the urethra comes from the bladder through the prostate gland and then enters into the body of the penis. Here is the glands, this inner tip of the penis, and then this outer layer here is the skin, which is the prepuce. So the sperm, like I said, they're created in the testicle. They're housed and mature in the epididymis, and during ejaculation, the sperm will be released from the epididymis and they'll travel through this tunnel here. It's not a tunnel, it's a tube, which is the ductus deferens or the vas deferens. Ductus deferens is a more appropriate name for it because anatomists once thought that this was a vessel instead of, and so they named it the vas, but it's clearly not a blood vessel. It lets the sperm travel out of the testicle. So there are obviously two ductus deferens, and those two ductus deferens are going to pass behind the bladder. So this right here is one of the ureters. There's another ureter buried under the peritoneum over there. So the ductus deferens, they travel behind the ureter, behind the urinary bladder, and they will eventually merge with the urethra. So the reproductive system and the urinary system share the same urethra here. So during ejaculation, the prostate gland will pinch off the opening of the urethra to the bladder so that urine does not mix with the ejaculate. So at this point in the ductus deferens, all we have are sperm. So there's a lot more components to ejaculate than just sperm. So there are some structures along the way which add components to the ejaculate. So then it's called semen. So the first structure that we run into are these two little wing-shaped glands on the back of the bladder. And I'll show you another view of these that shows them a little bit better. But these two glands are called the seminal vesicles. And they are going to empty, you see how they empty into the ductus deferens here. And where the ductus deferens is just about to meet in with the seminal vesicle, that is called the ampulla. So you'll see here where the ductus deferens gets a little bit widened. That is called the ampulla. And right after that ampulla, it merges with the ductus deferens here. And where they merge together and go in through the prostate is called the ejaculatory duct. So the seminal vesicles are going to add in components to help the sperm live, because the female reproductive environment is very hostile to sperm. The sperm have to travel a long way to get to where they need to go, and the female reproductive system, the vagina and everything, is very acidic. And so the the seminal vesicles are going to give the sperm fructose for energy and increased mobility. It's going to provide a substance which makes semen alkalytic so that it counters the acidity of the female system. And it's also going to produce prostaglandins, which soften the cervix. So, like I said, our bodies are designed to reproduce. So even the semen has a way to soften the cervix so that the cervix can open. And the ejaculatory duct that passes through the prostate's also going to add some stuff to the ejaculate. And the prostate's going to add prostate fluid. It's going to, it liquefies the semen here. And the prostate also is responsible for pinching off that opening into the bladder. And then we have this little gland right here. There's two of them. They are called the bulbourethral glands. And these create a pre-ejaculate. So this pre-ejaculate flushes out the urethra and lubricates it and gets it ready for the ejaculate. And at this point, it's the semen to be released. And that bulbourethral gland sits right in the urogenital diaphragm. And yes, men have a urogenital diaphragm as well. It just doesn't take quite the beating as a female's urogenital diaphragm takes. Okay. So we're going to look at now the different parts of the body of the penis. There is erectile tissue in the penis, just like there was in the clitoris. This picture is only showing part or half of the two corpus cavernosum. And the corpus cavernosum are what fill up with blood and become engorged, which causes the erection. So this picture is not in anatomical position. So if you were to put the penis up in anatomical position, this would be considered the dorsal surface or the back surface of the penis. So it follows the same pattern as the rest of our body, where our dorsal surface is the protective bony side, and the ventral surface down here is the soft underbelly side. So this tissue that the urethra passes through is called the corpus spongiosum. And this tissue does not become engorged with blood. And the reason why we don't want to engorge with blood is we want the urethra to remain patent during an erection. And the glands of the penis is also made up of that corpus spongiosum. So the glands stays soft during an erection as well. I did notice on a quiz it had like this surface labeled, so that would be the dorsal surface, and this underside labeled, and that would be the ventral surface. Okay, let's look at another view here. So this is looking at specifically the erectile tissues here. So this is a cross-section of the penis here, right behind the glands. And this picture is not showing the prepuce or the skin over the glands. So what we see here are the two corpus cavernosum, and you can see that they have a good-sized artery running through them. And that artery supplies all of the little cracks and crevices within the corpus cavernosum to fill up with blood. And the vein that would normally return the blood to the body to drain this blood gets pinched off. So that's how an erection is maintained. So the blood stays within these corpus cavernosum until after ejaculation, and then blood will drain through these dorsal veins here. So the dorsal vein runs on the dorsal side of the penis here. So there's a medication for erectile dysfunction. And one of the disclaimers you always hear is go to the emergency room if you have an erection that lasts longer than 4 hours. So what that medication does is it prevents these veins from draining the penis. So it can maintain an erection in the first place and for longer. So that medication, though, it can interfere with the draining of the penis after ejaculation. So literally in the emergency room, they will go in and they will aspirate the blood out of the penis. So that's what that medication does. So we have you can see the two chambers of the corpus cavernosum here, and they do enter into the pelvic cavity and attach to the pelvic bones. And the females have a similar structure, same name, and that is the crus. So the crus of the penis is where the corpus cavernosum come in and attach the penis to the pelvic bones. And then this space down here, it's not a space, it's an erectile body. It is the corpus spongiosum. And this one does not fill up with blood, like I said, and it has a urethra within it. And it runs on the soft underbelly side, so it would be on the ventral side of the penis. So, what else can we see on this picture? Just notice that the glands of the penis is here. That's also made up of the corpus spongiosum. All right. All right, so this picture was in your book, so I figured I'd use it. So this is the prepuce over the glands of the penis. And when a penis is non-erect, this glans is covered by the prepuce in a non-circumcised male. And during circumcision, the doctor doing it will place a ring around just on the other side of the glans, and they will trim around this excess skin. And it heals pretty quick, and a lot of controversy around it. Not going to get into it, but that's basically what happens with a... Okay, coming back to this picture, we're going to go through the different parts of the spermatic cord. So this is the inguinal ligament right here. You see that there is this is called the spermatic cord, basically. So this is a muscle that surrounds the spermatic cord. And if you removed this muscle here, you would be able to see the ductus deferens that will pass through the inguinal canal back behind the bladder, if you remember. And we already followed the pathway to that. And then you'll also see the testicular vein and the testicular artery. And the vein forms like this little mesh network around the artery. It looks a little bit different. But those are all encased in connective tissue, and then this muscle here, and then skin of the scrotum. So you can see that this little bundle here is all this stuff is bundled up in the muscle. And so that is the spermatic cord. All those contents bundled up is the spermatic cord. And the spermatic cord is going to enter in through the inguinal ligament, and it gets tunneled in through the inguinal ligament. So we have a, see if this is still on your white sheets. Yes. So we have the external or the superficial inguinal ring. So that's where the spermatic cord first enters into this big inguinal ligament here. So the inguinal ligament, we've got like this aponeurosis here. So the spermatic cord is going to, actually it's up here, sorry. The spermatic cord is going to enter into that aponeurosis through the external inguinal ring. And then if you were to look on the back side of this here, you would see where the spermatic cord exits. All this not necessarily the muscle, but the contents of the spermatic cord are going to exit out of this aponeuroses here. And that inner exit, I guess you could say, is the internal or the deep inguinal ring. So this one right here is the superficial, and then the deep would be behind this aponeuroses, and you would be able to see, you can see here, this is actually a ureter, but you can see the testicular artery and vein here. Okay. Let me make sure I got everything. I think I got it all. So let's take a look at the models and then we'll be done. So I take that back. There's one other picture I promised to show you. And this is the posterior view of the male urinary bladder. So you can see the ureters coming into the back. They enter in the same area in a female bladder as well. So just kind of to give you an idea where those ureters enter in the back. And these right here, these are the ductus deferens. The ductus deferens have come off of, so if we followed a sperm, the sperm come out of the testes. They're stored in the epididymis. During ejaculation, the sperm travel through the ductus deferens up through the body of the penis. They're going to go in the spermatic cord through the inguinal canal, and then they'll exit through the deep inguinal, or the deep, I think it's just a deep inguinal ring. Let me look. Yes, deep inguinal ring. And then they're going to come back here and run behind the bladder. And so this was the ampulla, or where it widens, the ductus deferens widens here. And these two glands right back here, those are the seminal vesicles. And you see where they merge together and form the, what is that called? Ejaculatory duct that passes through the prostate here. And then we have, these are the bulbourethral glands that are also going to add their contents. And I just realized that I didn't show you the different parts of the male urethra. So I'm going to do that really quick, and it'll be easy because now you know all the different reasons why they're called the way they are. So this right here, by the way, is the urogenital diaphragm. So you can see how those bulbourethral glands are embedded within that urogenital diaphragm. So my apologies. I totally spaced doing the different parts of the male urethra here. So the part of the urethra that passes through the prostate is the prostatic urethra. And you can actually see there's little ducts from where the prostate will empty its contents into the urethra here during an ejaculation. And then we have the membranous urethra, the yellow part here, that passes through the urogenital diaphragm. You can see those two little bulbourethral glands. And then this is the spongy urethra. And this is, this from the yellow down is the spongy urethra. And it's named that because it runs through the corpus spongiosum of the penis. So you can see little ducts here where the bulbourethral glands are going to send that pre-ejaculate to cleanse the urethra for the semen to come through. Okay, so here is our first model of the male anatomy here. You can see this is the scrotum out here, and there are some fibrous layers that we'll cut away here in order to be able to see the testicle. So A right here is for the testicle, and you can see the epididymis that sits right on top of the testicle here. And back here, you can see the ductus deferens, a little piece of it, and it's going to travel up with the testicular artery, vein, and nerve in the spermatic cord. So if I had a circle around this whole thing here, I would be looking for the spermatic cord. So here you can see the superficial inguinal ring, and you can see the glands of the penis here. And there is fibrous connective tissue covering the erectile parts, so we can't see those on this model. Okay. Okay, I stole this picture off your quiz too. So, what would be the answer to this here? So, this would be the ampulla of the ductus deferens. This thing right here, that is the ureters. The ductus deferens is right here. And the swelling of the ductus deferens is what the ampulla is, and that's what this question is asking for. This thing right here, and it's on this side as well, that is the seminal vesicles. Okay, and then this down here, that is the prostate. So, and then this would be the rectum. So here's the urinary bladder. These are the ureters, right here and right here. You can't see the front end of the ductus deferens, but the ductus deferens comes around here, and where it widens, it's called the ampulla. And we have the seminal vesicles on both sides and the prostate gland. I can't really think of anything else that you could be tested off this picture here, but I could be. And another stolen picture off your quiz. So what would be the answer to this? We're looking at a cross-section of the penis. It is outlining the corpus spongiosum. So that's the corpus spongiosum. This one up here, we're seeing one side of the two corpus cavernosum. And what else can we see? This is urethra, so you could see the different parts of the urethra. So this would be the spongy urethra. This would be the membranous urethra. This is the prostatic urethra. You can see the urogenital diaphragm here, the prostate. You can see the detrusor muscle, the rugae, which are not on your white sheets, but those, the little pouches on the inside of the bladder. You can see half of the urinary trigone. And this is actually the dorsal vein that empties the penis right there. That's what that is. This is the rectum and the anus. You can see a little bit of one testicle over here. And obviously this would be the glands if just this were selected here. And I think that's about it on that picture. Okay, guys, that's it. You did it. You made it. You did it to the very end. Congratulations. There's no more material. Just for a treat, I'm going to show you what I did to my dog. He's a big poofy Pomeranian. He's a big Pomeranian, which is called, I don't remember, a throwback Pomeranian or something. And he had so much hair, and he was shedding all over my house, and the groomers aren't open, so I had to take it into my own hands to shave off all of his hair, but I didn't dare shave around his ears. And so this is now my poor dog. His name is Milo. And he is literally the ugliest dog on planet Earth right now. He's a good boy, but I did a horrible job cutting his hair. So anyway, let me know if you guys have any questions about any of the material I covered today or in previous videos. I'm hoping to make some more review videos for you if you need them. Again, I won't put together a practice final because literally it's just taking the practice quizzes over and over again. And yeah, let me know. Congrats.